Hello, federal employees. This is Sierra with Plan Your Federal Retirement. Thank you for joining me on today's Fall Friday, where I'll be covering the highlights and action items from this week's episode. In episode 90, Micah and our special guest, Tammy Flanagan, were live on YouTube and discussed open season. Micah kicked us off by saying that this is a live recording on YouTube, but we would love your feedback on this. We want to hear from you on what speaks to you and what platforms you like. YouTube has really been blowing up for us. We love to get questions from federal employees, and when people ask us, what about this or what about that, that is where we really shine and what we are here for, to help clarify and understand these things about your federal retirement. Tammy has been working with federal employees for 35 years and is happy to help. Micah says that you're free to question anything they say. Sometimes people get conflicting information on complex topics like military reserve buyback time and what the HR agencies are saying, for example. This is your benefits, your money, and we want to give you the most information so that you can make the best decisions for your retirement. Tammy agrees and says that, hey, don't take anyone's word on anything, even ours. Tammy encourages you to keep your documentation as well in order to have that hard evidence, because sometimes OPM or even Social Security can make mistakes. Micah confirms that he had a client earlier this year and OPM had given them the wrong information. They were applying for a postponed retirement, and OPM said that, hey, you're 60 with 20 years of service and postponed MRA. OPM got the paperwork and said, nope, we're going to process this as an immediate retirement because that is what they thought that should have been done. Micah said he had a really nice guided discovery conversation with the gentleman at OPM and was able to get that processed as a postponed retirement. If the immediate retirement application would have been processed, then there would have been a penalty. This is a great example of why it's really important to know how those rules work and the consequences. Micah then transitions into talking about open season and all the changes with FEHB and Medicare, since there were a lot of questions that came up with all of this. Tammy lets us know that open season officially starts on November 13th, 2023, and it's going to run until Monday, December 11th, 2023. So you have 4 weeks of time to figure out what you want to do. Tammy encourages you to look at your FEHB plan brochure. They are showing rates for next year, and she has seen some plans, some of the HMOs, that are going up $175 a month. If you don't think your plan is going up, be sure to look again at the rates for 2024, and be sure to look at the rates and deductibles for increases. Additionally, review the summary of benefits to see what your plan covers. One thing that Tammy thought was really interesting was that some of the FEHB covers 50 sessions of massage therapy, which is almost 1 per week for the entire year. Micah encourages you to look at your plans each year, especially as plans change or even if you have life changes. Tammy brings up, for example, that people really like the Blue Cross Blue Shield plans, but there are a few different options to choose from: standard, basic, and the Focus. Maybe the Blue Cross Focus is a good plan for your son who just came to work for the government. But you, who may be planning on retiring soon, might need to look into the Blue Cross Basic plan. Look at the plans that's suited for your stage of life, your situation, your health, or even your prescriptions. It really does literally pay to pay attention to this. It could save you thousands of dollars per year. Micah asks about what the big changes that we saw come out of open season this year. Tammy answers that OPM sends out a notice to all the health plans at the beginning of the year, and it's called a call letter. It tells them what they want to emphasize for the coming year and what they might want to consider offering that's of valuable benefits to the feds. One thing that they've been noticing is that federal employees, especially those in early stages of their career, want coverage for things like maternal health. For example, Blue Cross Blue Shield is going to give $25,000 allowances for treatment. Another big thing that OPM wants to focus on is obesity, not just in adults, but also children. So they're going to start offering extra benefits for prevention and encourage people to find fitness and good nutrition. We are also seeing a lot of changes with Medicare. They are now offering Medicare Advantage add-on or enhancement to the FEHB plan. There are pros and cons, but one benefit is that anyone who is over age 65 who has Medicare Part A and or Part B, you're going to be automatically enrolled in Medicare Part D, as in Delta, the drug and prescription benefit plan. There have been some pushback from retirees saying that they don't want to be automatically enrolled. Tammy encourages that before you opt out of it, consider the benefits. It does cover a larger class of drugs, out-of-pocket expense, and it sets a limit on how much you have to pay out of pocket. The downside is for those in a higher income bracket, you may have to pay extra taxes to the IRS. Look at the cost of that versus the benefit of it, because it may or may not make sense. Mike agrees and adds on that IRMA does not just affect through Part D as in Delta, but also B as in Bravo. So that is something to really watch out for. If you break into those brackets, you are stuck there for a whole year until you can lower your income. Tammy lets us know that people are getting or have gotten a little bit of a scary letter in the mail saying that there is a deadline to opt out. But the deadline is actually before open season even starts. However, if you miss the deadline, you can still opt out. Blue Cross Blue Shield even says that you can call Medicare to opt out. Tammy says if you have questions, to give them a call because they're happy to answer them. This is new and we've never seen this before, but there was a new law because they have to limit on how much seniors pay for their medications. They found out that statistically, people weren't filling their medications because they couldn't afford to. This is supposed to help stop that from happening so people can maintain their health. Micah asked Tammy about Humana no longer being inside of the FEHB plan. FEHB had 174 different plans, but now they're down to about 158. Humana only had a total of 10,000 enrollments, so it isn't a major blow to the federal health plan. So for those that were enrolled in Humana, they have to pick a new plan. If they don't, they would be automatically enrolled in GIHA Elevate plan, which may or may not be the plan that you want. There are several examples of some plans going away, so Tammy emphasizes that it pays to do a plan comparison for the next year to find out the plan that you really want. Postal Service actually has a big upcoming change in the year 2025, so nothing for 2024, but starting April 1st, 2024 until September 30th, 2024, postal employees will have the unique special enrollment period where they can jump into Medicare Part B, as in Bravo, with no penalty. This is the greatest gift ever. If you have waited 20 years and now you have this once-in-a-lifetime opportunity to jump into it without a late payment penalty, typically if you waited 20 years, you wouldn't be able to afford it because it's a 10% per year penalty on the standard premium late enrollment. The standard premium is $174. Tammy really encourages us to look at it and think about it. Micah brings up that he had a conversation with a client about it, and they weren't really excited about paying for Medicare Part B. Micah tells his clients that when they have a larger medical expense, and if they can pay $10,000 to $20,000 out of pocket, then okay, that is a risk that you're taking. But the benefit to signing up is that yes, you have the premium, and that's the downside. But the upside is that your out-of-pockets go to almost zero. Instead of paying for it randomly, you are paying for it on a monthly basis. It's a pro and a con, but be really hesitant before you don't enroll in Medicare Part B, as in Bravo. Tammy encourages and says that sometimes these things are short-sighted, but it's really hard for the participant to see the long picture in all of this. If you're age 65 and in good health, it may not feel like it makes sense right now, but in 10 to 20 years from now, that probably won't be the case. You may have up to 40 years of life after age 65. Every plan family has one plan within that family that really caters to retirees who have Medicare. So some plans even give you money back on your Part B premium, or even waive the deductible copay or coinsurance. Medicare is a primary once you've retired, and the federal plan picks up the rest. Micah brings up a question from Maria, who asked, is HSA available for federal employees to sign up? And Tammy explains that HSA is a health savings account. It's a bank account that is FDIC insured. The federal health plan that offers this has to be a high deductible health plan. So there's about 4 to 5 of them throughout the FEHB. They will establish it for you, and HSA will get you that information once you sign up for the plan. Micah explains why HSAs are so wonderful. An FSA, for example, on the contrary, is a spending account. It is use it or lose it. However, the HSA is a savings vehicle where we get to put money into it pre-tax, and you get a tax deduction for any HSA contributions. And you can also invest that money. If you pull any money out of there for any qualified medical expense, it is 100% tax-free. It is almost turned into a mega Roth IRA that you get to save and build for medical expenses in the future. Micah thinks it's a fantastic tool that not enough people under age 65 look at. Unfortunately, if you are 65 and older, you can't do it anymore. Tammy also mentions that in 2024, the maximum HSA contribution according to the IRS is going to be $4,150 if you're in a self-only plan. The family plan is $8,300. Micah says that the 2023 amount is $3,850 and it's not too late to do that for this year. Micah brings up the pass-through credit. If you have a high deductible plan, an example is the GEHA plan, it has a pass-through in premiums, then they actually give you some of your own money back to the HSA. The self-only is $900 per year and $1,800 per year for the family. It divvies it up per monthly, and every month you see a contribution go into your HSA account. And you didn't make it, but your health plan made it for you. The monthly premium rates are also very reasonable for 2024. Tammy shares that she uses the HSA towards the Medicare Part B premium because she hasn't taken Social Security yet, so that's also an example of an option. Micah brings up that if you're under Medicare or TRICARE, then you are not eligible for this because you no longer have a high deductible plan. Tammy also mentions that if you ever change out of a high deductible plan, you still get to keep your HSA, but you can no longer contribute to it until and if you elect for another high deductible plan. Tammy adds that every time she talks about HSAs and has to mention high deductible plans, people's eyes glaze over. They didn't really do a good job at naming the plans, but if you look at all the other benefits, there is a lot to like about high deductible plans if you're eligible to make those HSA contributions. Micah says that you have good health insurance plans. Your high deductible doesn't even come close to what some people have to pay from the marketplace. And it's not even close to what is even a low deductible option. This podcast is all about action items for our listeners. Micah's action item is to take a peek at high deductible plan and HSAs. Pull your EOBs, your explanation of benefits. If you move to a high deductible plan, what would it really cost me? Tammy's action item is that during open season, do plan comparisons. You can go to OPM's website and click on the insurance link. You can click on what are available per your state, and then there's a plan comparison on there as well. Don't look at just the premiums or deductibles, but all the other benefits as well. And my action item is to re-listen to the original live episode on YouTube to hear the great conversation between Micah and Tammy. Share this podcast with a friend. With your help, we can achieve our goal of helping 1 million federal employees just like you. Until next time, happy planning.